In the months after we exposed drug-addicted nurses who kept their licenses and found new jobs while under investigation, the Tennessee Department of Health's taken emergency action to suspend their licenses more often. This is News Channel 11 at 6 o'clock. I'm Ann Carter, in for Sarah Diamond.
And I'm Josh Smith. Tennessee's nursing board identified more nurses as immediate threats in the last 8 months than it did in the year before our investigation aired.
And it's not just a slight increase. Community Watchdog Nate Morabito found out. The number of emergency suspensions skyrocketed by 360%.
In the year before our investigation, licensing boards only took emergency action 3 times against nurses. Since our investigation uncovered widespread addiction concerns within the medical profession, the state suspended the licenses of 14 nurses, most of them for drugs or alcohol, 2 from our region. That's according to the disciplinary reports available online. Are there areas you all can improve to speed up the process? Fall 2016, the Tennessee Department of Health pledges to speed up the disciplinary process for nurses.
We actively seek ways that we can improve our processes.
Public records show that's not the only improvement. These are just 2 of the nursing board's 14 emergency license suspensions ordered in the months following our investigation.
These are the current ones that I'm reviewing.
And if the cases piling up on Aaron McCardle's desk are any indication,
I found another one.
The nursing board may have more to consider in the near future.
All of these are from this year except one.
Since we last talked to the prosecutor, the number of nurses in Johnson City under investigation for diverting drugs only to find new health care jobs has only grown.
One that I'm reviewing that is really disturbing, the individual has diverted from 5 hospitals prior to being caught.
A new law prompted by our investigation and meant to prevent that goes into effect this weekend. It requires all healthcare workers who fail or refuse drug tests to enter treatment or lose their licenses. In addition, the law gives licensing boards more freedom to take emergency action when there's an immediate threat.
We also took the Attorney General out of the picture so that the Department of Health can make their own decisions without having to go through the Attorney General as to which ones are critical.
They continue to get employment and they get it quickly.
McCardle welcomes the new law and extra suspensions.
Hopefully, their action of continuing to divert medications at least will be stopped for that time period.
Through a spokesperson, the Department of Health says its boards haven't changed policy and continue to take the same approach of identifying people who, through complaints and investigations, pose an immediate threat to the public. So then, is the uptick just a coincidence? After asking the department the same question twice, a spokesperson would only say the agency isn't going to speculate or guess why the number of cases would change over a certain time period. Nate Morabito, News Channel 11, in your corner.
The new law also gives hospitals, clinics, and doctors' offices more protection to share substance abuse information regarding past employees with possible new employers.